A game changer that will transform lives. That's how a new cancer drug being trialled in Plymouth is being described. BTK inhibitors treat severe forms of leukemia and lymphoma. Patients in the southwest are the first in the world to benefit from the treatment, which increases life expectancy without the need for chemotherapy. Here's our health correspondent, Sally Mountjoy.
This was David Hodge in September 2012. He seemed well, but in reality had just months to live. Having had leukemia for 17 years, his immune system wasn't functioning and he was resistant to the treatments he'd had in the past. The film shows David as the first patient taking the first dose of a new drug that would change that prognosis. 18 months on, and David has astonished his medical team.
I've surprised myself, but certainly surprised the medical staff. The hemoglobin has come up and my platelets have increased, and my white cells, which were sky high, have dramatically dropped.
David's doctor is a Derriford haematologist and Plymouth University researcher, Professor Simon Rule. He's been leading the first international study of a new class of drug that improves the length and quality of life for patients with terminal forms of leukemia and lymphoma.
I think this is quite simply a game changer in the management of these difficult conditions. These are oral tablets. They have few in the way of side effects. In my experience, this is the most remarkable thing I've yet used. It offers the potential to be used instead of chemotherapy. And these are durable responses, and you've seen Dave, he's been on 18 months. This man had a couple of months to live at best and had no treatment options whatsoever.
Existing treatments like chemotherapy or stem cell transplants are effective, but in the case of very aggressive cancers, patients always relapse. The new drugs work by blocking a protein that allows cancer cells to survive. It causes malignant cells to die, but leaves healthy ones unharmed. Plymouth has become the European centre for research into this new class of drug, and patients come from across the country to be treated by Professor Rule. His next trial will explore whether the drugs can replace chemotherapy as a front-line treatment.
I feel thrilled for those who are going to follow on, because if it means, in fact, that they don't need to have chemo, which is so debilitating, but to have this other drug, then they're really going to find the benefits.
I guess the key benefit is the quality of life from the patient's perspective. Even if you don't see the tumour shrinking away completely, the patient feels well.
The professor says the clinical trial marks a transformation in the treatment of serious conditions like David's. Sally Mountjoy, BBC Spotlight, Plymouth.
A man charged